Hi Jim, my name's Jackie. The doctor had ordered some liver tests for you today, and I was just going to go over them with you. And I did highlight the really important parts, and you're also going to be taking this home with you. So the first one I'm going to go over is AST. The normal range is 10 to 40. The purpose is to evaluate liver and heart disease. Factors that may affect lab results include pregnancy, severe liver damage. Signs and symptoms of increased levels include fatigue, right upper quadrant abdominal pain, and nausea. Signs and symptoms of decreased levels include muscle weakness, metabolic issues, and fatigue or low energy. Implications are MI or liver diseases. An important post-test intervention is that unexplained AST elevations are further investigated with ALT and GGT tests. The next test is ALT. The normal range is 7 to 56. Its purpose is that it's primarily used to diagnose liver disease. Factors that may affect lab results include obesity and drugs. Signs and symptoms of increased levels include jaundice, loss of appetite, and dark-colored urine. Signs and symptoms of decreased levels include fatigue, generalized weakness, nutritional deficiencies. Implications include severe shock or MI and heart failure. The next test is ALP. The normal range is 40 to 130. It's used as an index for liver and bone disease. Factors that may affect lab results include fatty meals and those experiencing rapid growth. Signs and symptoms of increased levels include jaundice, bone pain or tenderness, and itchy skin. Signs and symptoms of decreased levels include numbness, tingling, muscle weakness or fatigue, and growth delays in children. Implications are liver disease and malnutrition. An important pre-test intervention is that fasting is required. And the next test is direct bilirubin. The normal range is 0 to 0.3. The purpose is to evaluate liver function and anemias. Factors that may affect lab results include prolonged fasting and anorexia. Signs and symptoms of increased levels include jaundice, dark-colored urine, pale or clay-colored stools. Signs and symptoms of decreased levels are there's no obvious symptoms or subtle signs of liver dysfunction and mild fatigue. Implications are cancer of the head of the pancreas or gallstone in the common bile duct. An important pre-test intervention is to ensure that the patient is fasting if possible. The next one is total bilirubin. The normal range is 0.3 to 1. The purpose is that it rules out any significant impairment of excretory function of the liver and ensures the liver is working properly. Factors that may affect lab results include a high-fat meal or air bubbling and shaking of the specimen. Signs and symptoms of increased levels include jaundice, itchy skin, or fatigue. Signs and symptoms of decreased levels include they're pretty insignificant, and it may indicate overall low red blood cell turnover, and there might be possible signs of underlying metabolic disorders. Implications are cirrhosis or anemia. An important pre-test intervention is that we ensure the patient is fasting if possible. And next we have albumin. The normal range is 3 to 5. The purpose is to evaluate nutritional status. Factors that may affect lab results include pregnancy or prolonged bed rest. Signs and symptoms of increased levels include dry mouth or skin, reduced urine output or thirst. Signs and symptoms of decreased levels include swelling in lower extremities, difficulty healing wounds, or fatigue and weakness. Implications can be burns or malnutrition. And the last one is total protein. The normal range is 6 to 8.3. It indicates overall protein in blood. Factors that may affect lab results include dehydration, low protein intake. Signs and symptoms of increased levels include thirst or dehydration symptoms, joint pain or stiffness, and fatigue. Signs and symptoms of decreased levels include swelling, edema, muscle wasting or weakness, and brittle hair or nails. Implications are malnutrition and albumin loss. And if you have any questions on this, Jim, please let me know. And you're also going to be taking this home with you today.